My presentation is on other health impairment. As defined in the Black Book, other health impairment is having limited strength, vitality, or alertness, including a heightened alertness to environmental stimuli that results in limited alertness with respect to the educational environment that is due to chronic or acute health problems such as asthma, attention deficit disorder or attention deficit hyperactivity disorder, diabetes, epilepsy, a heart condition, hemophilia, lead poisoning, leukemia, nephritis, rheumatic fever, sickle cell anemia, Tourette syndrome, and HIV/AIDS, or an acquired brain injury which may result from health problems such as a hypoxic event, encephalitis, meningitis, brain tumor, or stroke, and that adversely affects a student's educational performance. Because the Black Book definition was so broad, I split it up into two groups. There's a list of disabilities that I'm going to talk about briefly, just a small and simple definition, and then there's a few that I'm going to go more in depth about later in the presentation. For now, these are the ones that I just want to touch base on, just so you guys kind of know what they are. The first one is asthma, which I'm sure you've all heard of. It's just where you have trouble breathing, or it's defined as a respiratory condition marked by spasms in the bronchi of the lungs, causing difficulty in breathing. Diabetes, a metabolic disease in which the body's inability to produce any or enough insulin causes elevated levels of glucose in the blood. A heart condition, cardiovascular disease, generally refers to conditions that involve narrowed or blocked blood vessels that can lead to a heart attack, chest pain, or stroke. Hemophilia, a medical condition in which the ability of the blood to clot is severely reduced, causing the sufferer to bleed severely from even a slight injury. Lead poisoning, acute or chronic poisoning due to the absorption of lead into the body. Leukemia, which is a cancer, which I'm sure you've all heard of, is a malignant progressive disease in which the bone marrow and other blood-forming organs produce increased numbers of immature or abnormal leukocytes. Nephritis, inflammation of the kidneys. Rheumatic fever, a non-contagious acute fever marked by inflammation and pain in the joints. Sickle cell anemia, a severe hereditary form of anemia in which a mutated form of hemoglobin distorts the red blood cells into a crescent shape at low oxygen levels. HIV/AIDS, acquired immunodeficiency syndrome, AIDS, is a chronic, potentially life-threatening condition caused by the human immunodeficiency virus, HIV. By damaging your immune system, HIV interferes with your body's ability to fight the organisms that cause disease. So, for the first disability that I wanted to talk about in depth is epilepsy, and is defined as a neurological disorder marked by sudden recurrent episodes of sensory disturbance, loss of consciousness, or convulsions associated with abnormal electrical activity in the brain, which is also just known as seizures. There's a lot of different types of seizures that can happen, and I have a YouTube video that will later kind of describe that more. As for us as teachers, when working with students and planning for success, specifically referring to children with epilepsy, there are things that we need to take into consideration. First off, we have specialized instruction, which will cover the regular academics such as reading, writing, math, those kind of things. The first one I want to talk about is language arts. And when working with a child with epilepsy and language arts, one of the things I found to be a really good idea is to let the students have or provide them with index cards. That way when they're reading a story or someone's reading a story with them, they can use these index cards to write down a timeline of key events that are happening in the book. They could draw or illustrate characters, what they think they look like. You could also help a student symbolize certain things. And the purpose of these index cards is so that the children will be able to use them as a resource when they need to remember what that book was about, whether it's because they have to summarize it in a book report or present their favorite characters. This way they just have something to help trigger their memory because it's visually there and they're able to look at it. Another one is a graphic organizer, which is just a good idea so that they can, once again, visually see, but it's also in a way that is very simple and clear. It's not too broad or too long. It's straight to the point, and it will also help trigger what the book was about or whatever you're working with. Referring to mathematics, it once again says that it's a really good idea to give a child the exact formula they're going to need to solve a given equation. Along with that, it's a good idea to keep a little booklet, a small book or a journal, so that the child can write down those formulas and what they used it for. That way, when the equations get more difficult or they need to use a past equation, they're able to look back and use that as a resource. And it will be able to trigger their memory into how they used it, and they'll be able to use it and then follow the steps that are after. Regarding accommodations when teaching, it's just a good idea to be consistently repetitive, not just say it once, but to say it a few times here and there, just to let the child, if they're not really understanding, or it's just a good idea to keep it repetitive so they eventually get it. It's also a good idea to go at a slow pace, as well as to make it, once again, small and simple. Don't do it too broad or too long. Just kind of give the child direct directions or instructions when it's whatever it's regarding. I have a little YouTube video. It's about a doctor, and he just briefly touches base on the idea that there's different kinds of seizures that can happen, and it's kind of a medical information, but it's a good one.
Epilepsy is actually not one condition. It's a manifestation of people having recurrent seizures. By seizure, what I mean is the manifestation of an abnormal electrical discharge in the brain. Broadly, there are two main categories. One is what we call the generalized epilepsies, where we think that the whole of the brain is affected very quickly, and usually the child or the patient is unaware and loses consciousness, and both sides of the body are involved. And the other one, which what we call the focal epilepsies, where it's believed to involve networks in one area of the brain, and it doesn't usually spread to other parts. So the classic epilepsy, which is well known in sort of TV or movies, is the tonic-clonic seizures, when somebody falls to the ground, jerks, and cries out. So that's the tonic-clonic seizure, which is very obvious. So that's mainly with motor manifestations. There are other types of epilepsies where people just simply switch off and may not be doing anything much, and that's what we call absences. There are others where they may have just little twitches, little jerks. There are other types of epilepsies, particularly the focal epilepsies, where people can present with some funny sensations, can appear confused, agitated, maybe frightened, and not the usual self. And you may not see anything externally.
The next one I want to talk about is ADD, which is known as Attention Deficit Disorder, or ADHD, which is Attention Deficit Hyperactivity Disorder. And I'm sure all of you have heard of this. It's just, when I think of it, it's usually just when a child has a very short attention span, they can't really concentrate or focus for very long. But the definition I found is, it is any of a range of behavioral disorders occurring primarily in children, including such symptoms as poor concentration, hyperactivity, and impulsivity. When working with a child that has ADHD or ADD, there's a lot of things that need to be taken into consideration to help them plan for success. These ones specifically I found are for ADHD, and they're more of accommodations and modifications than specialized instruction. But the first one is seating. When seating children in a classroom, make sure to have that child be more to the front or near the teacher. When they're able to be closer to the teacher or to the front, they're more able to focus. There's not so much going on around them because they're in the front and all they're looking at is the teacher and probably the board or whatever the teacher is using. It's also a good idea to record assignments. Children usually have struggles with remembering spoken words, so having the child be able to record it on tape or to even have them have a partner that could help them take notes is a good idea. Along with this is homework. Don't give children with ADHD so much homework. Lessen the load a little bit. It's very overwhelming, and a lot of the time the child will not get as much done if it's a larger amount. So try to keep it small and to the point. As for tests, it's a good idea to give them extra time. It's not necessarily making them less of anything. They're having the same questions that are at the same level. They're just not as in such a rush. You're able to sit with them and actually assist them and see what they know. And the last one is errands. Because children have such hyperactivity, it's a good idea to have them go on small little errands for the teacher to help burn that energy that they have. This YouTube video I found of is a little boy that has ADHD. He's super adorable, but there's just a lady that's interviewing him and asking him some questions regarding his struggles and his thoughts about his experience with ADHD.
So it sort of feels like normal, but you don't know that you're not really normal. You just feel normal to yourself, but not really normal to other people.
Okay. And what does it feel like in your body when you haven't had any medicine or anything?
It feels like this hyper fire that never goes out. Even they always push the water on it, it never goes out. It keeps burning. It's just like this campfire. It just keeps going.
Okay. How does your brain feel?
Weird. Just nothing. It's just regular.
Okay.
It feels regular.
Uh-huh. And then what does it
Well, at least regular to me.
Yeah. What does it feel like after you've had medicine in your body for an hour or two?
Same thing. It doesn't really feel different. It just changes the way other people feel about me. I don't feel any difference.
Okay. And how do people feel about you when you have no medicine?
They sort of get a little bit hyper with me. Well, if you're talking about my friend,
Yeah.
well, me and my friend, well, we get as soon as I get hyper, he sort of tries to calm me down, and his sister, and they all try to calm me down, and their mom. So I just get hyper sometimes.
And does it work when people try to help you calm down?
Not exactly.
Yeah. Okay. What can people...
The last one is Tourette syndrome, which I've heard of, but I didn't really know, which is one of the reasons I chose it. Is defined as a neurological disorder characterized by involuntary tics and vocalizations, and often the compulsive utterance of obscenities. To help children with Tourette syndrome plan for success, there's once again a few things that we need to think about. And the first one is tests. When giving them a test, make sure to have them in a separate room or a place where they're able to focus and there's not so many people around. And once again, you're going to have to accommodate with the time. Sometimes you need to waive the time completely. Sometimes you just need to extend it. It strictly depends on the student and the severity of the disability. The next one is relief, which it's a good idea to let the child have a place to go to relieve their tics, and so they're not so embarrassed because it's happening in front of a class. Just letting them do that periodically is a way that will help them breathe, relax, and feel refreshed and be able to come back to class and be able to focus. Referring to that is also breaks. It helps lessen the embarrassment so that not everyone in the class is having to watch them. As far as guardians go, it's a good idea to continue to keep in contact with the parents, letting them know how things are going, what struggles are going on, what things are improving on. Just consistently being open and communicating with the parents is going to be a good and positive thing for that child. The next thing is to avoid things that are going to stress that student out. It's pretty common for that when a child with Tourette's syndrome is stressed, their tics become more obsessive and consistent. And the last one is to never let a child sit in the front of the classroom or make them sit in front of the classroom, because by doing so, the rest of the class is going to notice. It's going to have them lose concentration, and that child is likely to feel very embarrassed, and that is not what we want. This Tourette syndrome video is about a group of kids that have Tourette syndrome, and they kind of talk about what they do and kind of their feelings towards it, how long they've had it, and it's a cute little video.
What tics do you have?
What tics do I have?
Did you have?
Did I have in all my years of having Tourette's?
Or do now?
Okay.
What kind of tics do you have?
My worst one right now is I go like that a lot.
Yeah, I blink a lot too.
And then like roll my eyes back.
I hum.
That's a new tick.
I move my nose and mouth.
And I go like this in my hands when I'm nervous.
Yeah, I shake.
I'm moving my eyes up, it gives me a headache. Also shaking my head, doing this, that's 3. Bending down, 4. Making vocal tics like ooh and ooh, that's 6.
Gonna get the nipple rubbing tick out of the way now.
You serious?
The cursing tics are really bad. This, that's 8. And it just comes out. And I don't want it to happen.
When I'm eating, I hum as I eat things.
No, there's only 9, but I forget the 9th one. And I feel so bad that I have to do that. Out loud. Oh yeah, this is my 10th tic, like doing this.
I twirl my head around like this,
There's so many.
and I play with my fingers.
Last year, this new tic happened, and it was like a fire alarm. It was so loud.
What was it?
Want me to do it? Okay. That was non-stop. Like every second in school.
They're getting worse and worse. I'm getting more, and I just don't really like it.
Eligibility criteria. A team of qualified professionals and the student's parents determines eligibility as defined. 1. The health impairment must adversely affect the student's educational performance. 2. The student with the health impairment must require special education and related services. 3. The team must determine that the other health impairment is the student's primary disability. And 4. The requirements of the Rule 2.1 must be met. This last video is a video about what it's like to have an asthma attack. This lady kind of just describes the instructions. Basically what you do is you just plug your nose for 20 minutes and you breathe through a straw, and after doing so you're asked to describe in one word how that made you feel.
Asthma is a chronic medical condition that affects the airways, and it affects the small airways in your lungs, where children who have asthma flares, there is mucus in their lungs and there's constriction. And it's often been described that if you're breathing through a straw, that really shows you what it feels like to have an asthma attack. So we're challenging several people to breathe through a straw, which is a straw challenge. And essentially the instructions are to hold your nose for 20 seconds, and while holding your nose for those 20 seconds, breathe in and out through a straw. And after those 20 seconds, in a word, describe how you feel. In one word, tired. I felt tired the more I breathed, the more I felt like I can't keep doing this. I'm gonna pass out very soon.